I think that you can appreciate that this is a very special moment for me personally. Thank you for joining us at this symposium. I'm most grateful to Monty and Leo for their kind introductions, and to Pam, Carl, Carol, and Lily for their thought-provoking presentations. Well, this is my opportunity to respond to them, so let me begin. Pam spoke eloquently about the virtue of dentistry as a learned profession. She presented the concept of a calling for us to a vocation as caregivers and as educators. I fully subscribe to this notion. In my interactions with applicants and students over the years, I've always been impressed with the ways in which they first thought about a career in one of our professions. I rarely heard that it was about money or lifestyle. It was almost always a desire to be part of a profession that hopes to care and heal, one that is constantly seeking new knowledge and discovery, and one that inculcates innovation and scholarship in teaching and learning. These are the hallmarks, to me, of a learned profession. And through the work that each of us does at our own institution or association, we declare that we will ensure that the next generations of dental professionals will inherit these virtues from us as we did from those who came before us. I'm most impressed with the students in our schools and programs today. Over the past month, I had the opportunity to participate in 2 ADEA student chapter hackathons, one at Boston University, at which 7 schools were represented, and one at Western University of Health Sciences, at which 5 schools were represented. These hackathons provide an opportunity for students to work in teams to develop ideas about how the curriculum must change to meet the needs of the future. I was struck by the depth of the concepts that they presented and the potential impact that they may have. Needless to say, I believe that we are in good hands. My observation is that our students are already developing habits that promote flourishing in our learned profession in the future. Pam was an ADEA president early in my tenure at ADEA. In fact, she was in our Washington, D.C. office on September 11th, 2001, at the moment that one of the hijacked planes struck the Pentagon. Pam and I worked together during that time to create what is now the ADEA Guys Foundation, our philanthropic arm that is growing in its ability to provide funding and recognition of people and ideas that will continue to promote dentistry as a learned profession into the future. Those of you who know Carl Hayden appreciate the exceptional value that he has brought to developing leaders at ADEA and beyond. What many of you perhaps don't know, but you might appreciate after his presentation today, is that he's a philosopher by education and training. After he joined ADEA, I was able to share with him enough of our secret handshakes that most people thought that Dr. Hayden was, indeed, a dentist. But he knows that the Cuspa Carabelli is not a mountain in the Italian Alps. His ability to be immersed in multiple professions all at the same time has provided the bridges that we need to focus on developing leaders for the future who do instill habits that promote flourishing among ourselves, themselves, and all those that they hope to lead. I know that many of you have been at sessions on leadership. So often the presenter will begin by identifying the attributes of a good leader from that person's perspective. Over my career, I've come to believe that the most compelling attribute of great leaders, by far, is the ability to instill hope in those they are positioned to lead. Hope does spring eternal, and it gives us a sense that our lives will be better if we follow this leader. Hope can instill trust in the relationship between leaders and their followers, and allows people to bring a personal commitment of hope to share with others in their community. As Carl noted, when I started at ADEA in 1997, 6 dental schools had closed, 7 others were under consideration for closure, and another one was yet to close in 2000. Class sizes in the surviving schools were slashed. We went from 6,300 dental graduates in the 1980s to just 3,900 in the 1990s. 6,300 to 3,900 in just a 10-year period. It was a challenging time and very hard to be hopeful. There was a bunker mentality throughout our community, and many were worried that their school might be next. Carl mentioned the leadership summit that we held in 1998. One of the most critical recommendations that came out of that summit was that the dental school should be considered the front porch of the university. It was an idea that gave us hope that we could reframe the value that dental schools bring, and we have. So think about that image of the front porch and how our schools and programs engage the local communities in ways that no other unit of the parent institution can. Through student teaching clinics, faculty practices, mobile vans, our presence in FQHCs, Give Kids a Smile and Mom events, and so many others. Through these interactions, we provide leadership in sustaining dental schools through difficult times, and again, develop habits that promote flourishing of our schools and the patients that we serve. We're out of that bunker mentality now. 13 accredited dental schools have opened since 1997. Carol Aschenbrenner presented a compelling case for the way that we should view interprofessional education and collaborative practice as virtues. This day, today, represents in some ways a circle of life. Let me explain. Dr. Aschenbrenner is a physician educator, one who embraces oral health as a key component of overall health, and dental education as a peer, an equal peer in health professions education. Dental professionals have become valued participants in healthcare teams on campuses and with patients. I think that you know that we as a DIA share office space in Washington, D.C. with the Association of American Medical Colleges, the American Association of Colleges of Nursing, the Physician Assistant Education Association, and the Association of American Veterinary Medical Colleges. But we've not always enjoyed the strong relationships that we have in dentistry with our physician colleagues. I've attended a flurry of 150th anniversary celebrations at several dental schools over the past couple of years. Why did so many dental schools get started in the post-Civil War era? Well, at that time, dentistry was becoming quite sophisticated, but there was a disconcerting variance in the level of quality in the institutions that were offering coursework leading to a dental degree. Evidence-based dental educators in cities like Boston, New York, and Baltimore attempted to find opportunities to develop departments of dentistry in medical schools, but were essentially rebuffed by their physician colleagues in every case. So they started independent dental schools, only some of which would become part of a parent institution. But perhaps these defeats were milestones in the development of dentistry as a profession as we now know it. Because it's my view that if we had been welcomed into medical schools at that time, we probably would have been subsumed as a subspecialty of general surgery and would not have flourished in the way that we have since then. Carol and I were invited as leaders in the Interprofessional Education Collaborative, or IPEC, as she has talked to you about, to participate in a day-long program at the White House about 4 years ago on ways to enhance interprofessional education and collaborative care through the Affordable Care Act. There were about 45 key leaders in health professions and higher education in the room, university presidents, directors of large health systems, people who were in leadership roles in specialty organizations in medicine in particular. So the meeting began by participants identifying who they were and why they were there. Thankfully, I was the last one to speak. And I started by saying who I was and how I could bet that no one in the room could understand why dentistry was at the table. And in fact, as I looked around, you know how those faces get squished when they're trying to figure out what's going on? I then explained that we have over 500 million patient encounters a year. We see patients when they're well for the most part, not when they're sick. We have a history of prevention and interdisciplinary practice. The fact that oral health has a dramatic impact on the readiness of our military forces. The relationship between oral health and systemic health. The fact that inflammation is inflammation wherever it may occur. And a variety of other factors that I want to. So 3 times during the rest of the day, someone said, why can't we learn from dentistry? There is true virtue in IPE, in collaborative care, as it promotes flourishing at all levels of patient care and the education of health professionals. Lily Garcia made a wonderful case for the virtue of diversity in dental education. We're at a time of tectonic change in our society, as Monty alluded to at the beginning of our program. And given the polarization of our national and local politics, we may be at a tipping point for the future of our country. It's difficult to look at demographic trends and not see a future that will be much different in the racial and ethnic composition of the nation in the future compared to what it is now. How do we prepare a professional workforce that has the cultural competency to care for that population? Remember that the students who graduate this year are likely to be practicing in the year 2060. Can we promote habits now that will promote flourishing in a changing society over the length of their careers? Certainly, we see the impact of Adia's work already. The applicant pool for the dental school class that entered in the fall of 2016 was for the first time majority women. And for the class that entered in 2018, the majority was not white for the first time. The summer medical and dental education program that we have led with the Association of American Medical Colleges, supported by the Robert Wood Johnson Foundation, now known as the Summer Health Professions Education Program, provides a summer enrichment program for educationally disadvantaged students interested in the health professions at the end of their first or second year of college. Completion of the program doubles their chances of getting into medical or dental school. We've been doing this work since 2006, and already there are more than 600 of these participants who have had graduated from dental school, representing nearly 25,000 years of clinical practice over the times of their careers. We're making a difference and promoting flourishing of these new clinicians themselves, the schools that they attend, and the people in the communities that they will serve. Lily's the chair of the planning committee for 2 of our upcoming meetings in April in Italy, including the 6th ADIA International Women's Leadership Conference. I do believe that to be virtuous is to instill habits that promote flourishing in ourselves and in others, as Aristotle has said. We become virtuous through education to develop and practice those habits. In the end, though, ensuring that our own lives flourish and that we help others to flourish is up to each and every one of us. Thankfully, I've had colleagues like Monty, Leo, Pam, Carl, Carol, and Lily, and so many of you in this room today who have helped me in my professional and personal journey. I have learned and developed so much in this position. I thank you for all of the help. I'm grateful to all of you for being here today for this very special moment for me. Thank you very much.
Ladies and gentlemen, Dr. Rick Valachovic. Thank you. Thank you for your service. Thank you.